thing we will get was this money. The woman was just working on her own. No olive oil. There was nothing. And the Anna, we are saying, Madam, you are in labor, or see making 7 months. So as at the time we are treating as a premature contraction, but by the time I look at the size of the uterus, say this size is usually the size of 9 months. But the woman is saying 7 months. In fact, she started from 6 months. It is when we start counting. From October to now, it's 7 months now. It's okay, it's 7 months. She now agreed with the 7 months. By the time we delivered the baby, in fact, before this morning, the child had opened her eye, cried very well, eats very well. There are only one. Let me tell you the truth. I have to go and buy glucose because the woman that accompanied her now say, let her go and buy other things. We didn't have anything. There was nothing. Use normal spoon and give to the child. It's not even up to one hour that the woman so that they were not planning for anything. But assuming that the lady is 7 months, assuming that one is 7 months true, does it mean that she have to wait after 7 months before she start buying the young one? She doesn't even know the sex of the baby. There was no ultrasound. In fact, it was last month that she took the first TT. Now I'm about TT last month to go the 5 months. And the baby are. So most times you might think she is not being truthful. She may be as truthful as she can be, because some women might be spotting much into 3 months. She might spot into 4 months. So by the time she spots into 3 months, on the 4th month, this 1 month, no mystical period. But in most cases, some of them will end up treating malaria, treating infection, calling. In fact, there was one that came. That is one truth that looks like a lie. The woman came and said she has a kidney problem. The body was so swollen. Everywhere was swollen. And she was actually on the big side. We did every test. In that case, we didn't even start doing pregnancy test. She was already on admission. By the time we checked, the BP was 180 over something. We did the analysis. There was protein everywhere. No, that picture can also be seen in kidney disease. But we look at the tummy. The tummy is big, but back as it big. We put a fetoscope. Then we now hear the fetal heart that the baby is beating there. The woman says she's not pregnant. And then the way she was saying it, she will even confuse you. But if you put the fetoscope, you will hear the fetal heart. And the woman is telling you that she's not pregnant. And then it wasn't a dear travel for 5 months ago. By the time we now see, we did ultrasound, everything was pointing towards that this baby, but that one was, ultrasound was talking about 35-36 weeks. But the woman was having severe hypertension. So she was having pre-eclampsia. We have no choice than to deliver that baby that day. One CS. One day the CS again. No, CS we have to take the man into the theater. We have full regalia. Doctor. It took we are somewhere. She was there. He was there to witness everything that happened in the theater, and we brought out the baby boy. That one looked like a lie. That woman, I don't know if she was having psychological problem. How can somebody be pregnant up to 7 months? There are some things that a woman cannot deny. Once the baby is 7 months, she can deny it in 5 months, before 5 months, when the baby is not kicking. But this one concluded that she is not pregnant until the baby came out. Perhaps we didn't follow her up. When we discharged her, she left. But you see the way she was shouting. I don't even understand. It was later that I realized that perhaps within that first 2-3 months with the husband, she might still be seeing some blood, which she calls menses. When the husband had now traveled, she now resolved her mind. Even when she's seeing signs of pregnancy, she will ignore it. After all, when you hear me, now here can have menses before the husband traveled. But by the time we checked and saw that the baby was fully matured. I didn't know how the story ended anyway, but I'm just telling you that it is possible for somebody to be pregnant and be spotting, and some of them will call it menses. It's not menses. It might be spotting. Okay?